Back out on the water. Let's tell another emergency medicine story. So, this was a medical shortness of breath at a residential location. We get there and we find this lady laying down on her back. She looks cyanotic. She's purple around the eyes, the nose, the face, the earlobes, etc. Her skin is cool and diaphoretic, meaning it's profusely sweating. Firefighters already have her on a non-rebreather. That's a oxygen mask at high flow, 15 liters. Somebody puts her on the monitor and somebody starts to look for IV access. We got somebody helping her to sit up, propping her up on pillows the best we can to at least get her in a semi-sitting position. I listen to her lung sounds and she's barely moving any air. She looks obviously hypoxic or without oxygen. In other words, this lady is in a bad way. And well, first of all, when I sat her up, I vividly remember her reaching out to me and holding on to my wrist and digging her fingernails into my skin. And the pain got my attention, and I looked up at her, and her eyeballs were popping out of her head, and she said 2 words, "Help me, help me." And that's what we call speaking in 2-word sentences. That was about all she could manage with the amount of air that she was drawing in. We get a firefighter behind her, trying to help her, assist her breathing, what we call positive pressure, to try to open up her alveoli, or the grapes that the lung tissue consists of, on a much more microscopic scale. So what is happening is there goes a fish. He just took off with my, oh, look at that. That was cool. That's par for these bodies of water. So we're attempting positive pressure, trying to get that fluid back across the alveoli and open up her lungs so she can breathe a little bit better. Difficult to manage, but we're trying to do that. Firefighters are helping me out. We get an IV established, thank God. We get vital signs. We take her blood pressure. She's got an adequate blood pressure. I believe it's hypertensive, which is a good thing because that way I can give her medications that will dilate her blood vessels, drop her blood pressure, as well as decrease the workload on the heart so it's not pushing fluid into her lungs. Yeah, we want air in her lungs, not fluid. We give nitroglycerin under her tongue and a 1/2 inch or 1 inch nitroglycerin paste. It's literally paste that comes out of like a toothpaste tube. And you put it on a piece of paper, and then you adhere the piece of paper, you stick the paste onto her chest or onto her back. And then we give her Lasix. That's a diuretic, and that helps diurese her. All this medication, again, is to decrease the workload on the heart, and then the diuretic is to get the fluid moving in the right direction instead of into her lungs. So anyways, she did not initially respond in the house, so we got her loaded up. We got her into the back of the ambulance. We got her en route, made the phone call to the hospital, let them know we're coming, what our ETA was, and we continued treatment. She did get better. She actually was awake and able to speak. Her color comes back, her skin dries up. It's pretty amazing what this actually simple treatment can do for a person who is literally dying from their heart becoming so ineffective that fluid starts to move in the wrong direction and starts to fill up the lungs. And then it's like being underwater. You're literally drowning on your own fluid. That is a typical CHF, or congestive heart failure, call. As the one Navy SEAL YouTube channel, forget his name, 7 something, says, "Nuff said." As you were, guys.